Good morning, everybody. Thank you for joining our webinar today on grant writing. I would first like to introduce Elizabeth Burrows, as my email I sent this morning did have a typo in it. She has actually worked in over 36 states with more than 170 clients, bringing in over 220 million in grant funding since she started her business in 2014. Prior to starting her consulting business, Elizabeth served as the founding chief executive officer for 7 years at Valley Professionals Community Health Center, a rural FQHC in Indiana that grew over 1,000% in her tenure. During her time there, she brought in over 10 million in grant funding and started 3 financially viable and clinically strong clinics and 1 mobile school-based health center, with excellent reviews of grant applications and stellar federal site visits. Before that, she was the director of the State Office of Rural Health in Indiana, where she tripled the amount of grant funding received by the Indiana Office of Rural Health. Her education began at DePaul University, where she earned a Bachelor of Arts in Political Science and Communications and studied abroad at Oxford University. She then obtained a Doctor of Jurisprudence at Indiana University School of Law in Bloomington. She is a graduate of the National Leadership Academy of the Public Health and a National Helping Hands Rural Health Fellow. I will now turn it over to Sharon and Gail, who I thank for this opportunity to speak today. Do you have anything to add before we jump in?
Just want to say thank you to everybody for jumping on. Elizabeth has huge knowledge of all kinds of things. She's been a consultant for us for a number of different projects we've been doing in Wyoming. And I also wanted to apologize because I have to jump off early. I managed to break a bone in my hand, and I get to see the orthopod today at not very long from now. And I am hopeful, so hopeful that he's going to take my cast off. And I did not want to miss that. You know, you take them when you can get them, because getting in can sometimes be long. So I will turn it over to Elizabeth.
Thank you. And I will apologize if you're hearing background noise. I've been waiting on contractors to come and fix a bathroom issue for about 2 weeks. And of course, they come right at the most inopportune times when I'm getting ready to do a training. So I popped in my AirPods, and I really hope that that this will, you won't have to hear that. So anyway, okay. Well, thank you for joining. It has been great working with Sharon and Gail with the swing bed project, and now with some of you on this. And I really hope that you can take back, I always say, I just hope you can take back a little nugget of something that you've learned to bring more money to your hospital or your rural health clinic. So I really hope today that you learned something. The slides will be shared, as everybody always asks, and this is being recorded too, so you can share it with the others in your organization. And we definitely want to have that happen. How did I fall into grants? My first grant story is that my hometown of Cayuga, Indiana, which is about 1,100 people, was named one of the 3 worst rural areas by USDA Rural Development in the whole country. And as part of that, they influxed money into those 3 areas. And I don't even know where the other 2 were. There may have been one in Wyoming for all I know, but this was my town, and I was 19. And so they hired me as a summer intern to come up with ideas of things to do to help to improve my town. And one of those things I got to do was write grants for places where I saw a need for that. And one of those very things was I came home from college in 99, 2000. That was the school year. And I had no way to get in touch with my friends to email people that I cared about that I had met at college. And so the libraries had no local internet. There were no coffee shops. And so that was one of the things I did is I wrote a grant to the Gates Foundation to get internet and computers at our local libraries. And lo and behold, I got it. And since then, I have been addicted. And most people tell me, I hear this over and over. Once I get my first grant, I want to get more and more and more. It is an addicting process because you get to see the impact and the difference that is making. And when I got to come home that Christmas break and see people using the internet, and I thought it would be younger people like me. At the time I was 19, I thought it'd be people about my age, but instead it was all the older people who had heard of this great thing called the internet to do their Christmas shopping. But still a great experience that we got to get internet and computers in those local libraries. Since 2014, a business that started as a side hustle while I did another job and wrote grants on my couch, we have since grown and have an amazing team now, and we're at over 225 million in grant funding for our clients. And prior to that, I brought in 25 million before that for companies that I worked with. And that doesn't even count the internet and the libraries and some of the things I did at USDA Rural Development. So grants have always been an important part of my life, and it is a great way to get funding. I will say one of the important things is we really want to create sustainable funding projects. So I want to make sure that that you always have a project that is fully sustainable. So the first thing, before you ever find a grant or go searching down the Google rabbit hole, grants for my hospital or whatever you're going to do, the first thing you have to do is you always have to know your why. Why do you want the money? Why is your idea a good investment? Why do you want to do this? Why is there a need for it? And why will your idea or proposal solve the problem? And this is my why right here, these three things. Two of them are my daughters that I talk about a lot. They're 11 and 13, a little bit older, but this was us on Easter during COVID when everybody had to stay home for Easter and couldn't do their normal festivities. They were dressed up and excited. The building beside them is actually the clinic where they get healthcare in that hometown of 1,100 people. That was one of the worst places by USDA Rural Development. That is actually the FQHC that they go to for their healthcare. Um, and I have my Mayo Clinic logo there because Mayo Clinic saved my life with my personal battle with Crohn's disease. And so until my daughters can get Mayo Clinic quality care that's open to everyone, regardless of their ability to pay in my hometown of Cayuga, Indiana, I'm going to keep on doing what I do. And I imagine some of you have similar whys. But I will tell you, knowing that why is so important for ensuring that you will get the grants that you want, and that passion is going to show through. So you want to make sure you really do know your why. And sometimes as I'm sitting down to do paperwork, to do paperwork and starting to write a grant, if I focus on my daughters and that high quality care, it always brings me back into focus and keeps me passionate about what I'm doing. So again, as you sit down, again, this is before you've ever even found a grant application. Gail hasn't sent you one. You're not already researching it. You're not outlining it. This is right now before the federal grant season even comes into play, or before you found the perfect foundation grant. You need to think, what makes your organization unique? And I will tell you, I go to church just across the state line in Danville, Illinois. And I laugh because everywhere you turn, there's two things in Danville, Illinois. Everything, Dick Van Dyke is from there, so everything is Dick Van Dyke. There's Mary Poppins everywhere, and Dick Van Dyke pictures are everywhere. Or it's Abraham Lincoln because it's part of the Abraham Lincoln Trail. And literally everywhere you drive, everywhere you turn, you see one of those faces, Dick Van Dyke or Abe Lincoln. That makes that town unique. They have embraced it. And so I know each of your cities, your towns, or your communities are unique. So what makes you proud and what makes that different? Knowing that is going to be important. You probably have it in your community health needs assessment for the hospital. You probably have it in your marketing material. Again, just getting all these documents organized. What makes you special? When I walk into most critical access hospitals, and it sounds like Gail and Sharon get to do that today, I'm a little jealous because it's one of my favorite things to do. But we know we are going to see 25 beds or less. We're probably going to see some swing beds. We're probably going to see a lab. But there are also a lot of different things. I've walked in critical access hospitals to see telecardiology units. I've seen ICU units, special care units. I've not seen those in certain critical access hospitals. I've seen clinics in the ER, RHCs or FQHCs right by the ER in critical access hospitals. So there are still things that make you different in what services you provide. So make sure you have this all outlined, written down, what makes you special. Sometimes there's a doctor or provider there that makes it special. And then think of any success stories that you have. And I know you all have those amazing success stories. So think of, the time that you were able to keep a local resident in their hometown during COVID with your swing bed, and they didn't have to get transported across the country or across the state, whatever, for care. So think about anything like that that's going to make you different and highlight that, have that written down and have that ready. And then how do you get started? So these are the things I think you need to get started. And we're going to talk more about grant research later, because to me, that's one of the last things that you do. But to me, these are the things you need to get started. And we always laugh because this is my cup of ambition, my Dolly Parton cup, but it has all the colors of Sharpies, pens, pencils. You got to have all the things. Everybody who grant writes has to color code everything. It's very common. So make sure you're ready. I always highlight anything with budget is in green, has a green Post-it. It's ready for those things. So make sure that you're ready for that. Make sure you have your heart. That's always the highest thing. That's the highest thing in the Bible. And you have your heart that you do care. You know your why, you know what you care about, and that's going to show through. If Gail wrote her grants to the Flex program and didn't care at all about the hospitals, she probably would not get funded or would get her funding cut. But by getting out there, knowing the great work they're doing, and when she writes that, it's going to show all the great tours you've given her, the information you've provided. You also need to have your wish list. And this should be the same. You don't want to just always just go after whatever grants available. You know, that doesn't always make sense. And I think we all know organizations or places that have done that, and it's not super successful. So you want to have your wish list and know what you want. And I will tell you, it's oftentimes easier to get people funded than things or capital funded. So always be thinking of ways to get people funded that then you could backfill and help pay for the new facility, because construction and EHRs are hard to get funding for, and most people want that funding. So is it doable? Definitely. And we're going to give you some resources. But again, also having your wish list for staffing or for current staff or programs, oftentimes that is easier to get grant funding for, specifically federal grant funding. And then you need time. And by time, I literally had a hospital call me a few months ago, but it was in 2023, and said, hey, there's a grant available. We're meeting with them on a Friday afternoon, 4:00 Eastern time, I believe. And they said, hey, there's a grant is available. It's due Monday at 5. We think we're going to write it. Could you help us? No, we have written grants in 6 days. We aren't proud of that, but we have done it and been successful. But again, if you're thinking on Friday, you're going to submit a large 100-page grant by Monday and ruin your whole weekend, probably not worth it. My guess is it's not going to be successful unless you have talents beyond anything I've ever seen. You need time to plan, to involve the proper parties, and make sure you're ready. Okay. And this is one where it's, I try to kind of go in order of what I think you need. This could be the first thing you think of, and oftentimes it's the last thing. I put it in the middle because I definitely want to promote it and make sure it's a higher level on your priority list, but making sure you have networks and partnerships. So, you definitely want to network with high level people. Everybody wants to, I'm going to talk to the CEO of this foundation to make sure I get money. That's great. But you also want to network with low level people. Make sure your local congressional offices know the great work you're doing, that you've invited them in, not just the members of Congress. They're often the ones that can help push your applications through at the federal level. It's amazing the money that's been going to Kentucky since they have Senator McConnell, that his local offices really help those healthcare providers write grants and are active with that. So make sure you know your local members of Congress, talk to your chambers, your local foundations, and you have your why ready, your elevator pitch ready. And then always think of other partnerships, things that aren't normal. Everyone's used to getting grant applications as maybe like the local health department, the rural health clinic, the critical access hospital. Back in the day, before FQHCs and critical access hospitals got along, we got a lot of money because we were one of the first. My critical access hospital CEO and I was the FQHC CEO. We went and presented and wrote tons of grants together, and it was very effective for us, 15 years ago. But now think of people, schools, any kind of local social service agency, or maybe hospitals in other states. There, federal grants love grants across state lines. Thinking anything innovatively, people that you work with, they love private-public partnerships. So think, how do you involve those people? Always think about your networks and your partnerships and maximize what you have, and then always work to strengthen anything that you don't have. And then as you sit down to write out your story, and to me, this probably should come before even you've looked at a grant, but it could come after you have a grant. But make sure you write out your story, write your elevator pitch to the committee or the team working on this. And then as you write out your story, make sure you have someone who knows nothing about your hospital read it. So Gail's not your person. She already knows something about your hospital, okay? The nurse that works in the other department, the other nurse lead, they already know something about the hospital. I always make my husband read things because he doesn't work in healthcare. He doesn't know any of the organizations. I don't know who that is in your life, and he's also an English teacher, so that makes good sense. But I don't know who else is in your life, but have your child read it. If they're in college, say, hey, would you proofread this? Have someone that you sit by at the football games on Friday nights. Have them read it. If you know that they have some intelligence, make sure they understand it. This is all here. If you're writing like her or where they need the healthcare, that's writing to a foundation. No healthcare acronym really. People more acronyms there than anyone else I know. And you don't even think, as we're saying cause, if most people on a United Way grant committee are going to have no idea what a CA even is, right? They're going to say, did they misspell something? So, reread your story with an open, clear mind when you're not being interrupted, and then make sure, why are you wanting to write the grant? Your whole team knows, and everyone's on board with why you're doing this. So. And then gathering the necessary information. This is becoming more and more important, and I don't really have a slide about it because it's boring, but making sure you know who has authority to submit, whose name is on the sam.gov registration with the UEI, who's on your portal, different state portals now. I'm not for sure what's happening in Wyoming, but I know in Tennessee and Kentucky now you have to have state portal logins to do state grants. Many of the local foundations are now going to larger, like the local foundations now have like these big Benevity and other big portals that run all their grants. And you have no idea how many times it happens that the person who is on your documentation for the feds or for this portal no longer works at your hospital or your clinic, and you've got to change that. And this may take time, and you've got to change the email, or the emails have been updated, or now you're married and you're a lady, and so your name has changed. So again, just making sure all of that necessary information is up to date and you know who has the authority to submit the grant. We did write a grant for a critical access hospital. It was amazing rural health network grant that never got submitted because we did not have the right authority log in to submit on the final day. And I'm still bitter. And that was about 4 years ago. So that has happened to us one time, but you never want to put forth all that work, have all the letters of support, have all the people involved, and then not be able to submit. So make sure you know who you need to meet with, why you want the money, how you're going to use the money. And this last one's really important. It's probably where healthcare can beat the other organizations because we kill it on overseeing and tracking measures, right? We track everything in healthcare. We have all the documentation. So if you are applying against, schools or other nonprofits or other mental health organizations or something, this is where hospitals and rural health clinics can really stand out. Make sure you know what's going to happen and when it's going to be implemented and how this will be carried out and who's going to do it. This is something that in the Great Resignation timeframe, people are scared. I don't want to put Hannah down as the person because she might leave, or if I put down Elizabeth, I think she's retiring in 6 months and what's going to happen or what happens, excuse me, if we do have a change in staff. I can tell you putting down, everybody understands sometimes people leave and sometimes you have a turnover in staff. That's just common, especially right now. Put down people who are responsible and who you think are going to be responsible today. Funders understand things change a year from now. That funders understand things change a month from now. But again, it looks a lot better to put somebody down than to say to be hired, because again, that's going to slow down your implementation. There are sometimes that's what you have to put down. But again, I think it's best to name a name when you can. Okay. Developing a grant plan or timeline. As you sit down and you do have a grant application that you're going to submit, make sure you have that proofreader. Write out your story into the questions that must be discussed in the grant. So again, oftentimes with grants, you are repeating yourself, but I have literally had members of HRSA, people that work at HRSA, tell me if they say to do it in 1A and it's the same information in 1C, put it in both. Don't put C1A. Nobody likes that. But actually, rewrite it and address it every single time. It does feel like you're repeating yourself. That's grant writing. I don't know what else to tell you. Set your deadline, if possible, 4 days before the grant is due. Divide tasks. Know what you're going to need from other partner organizations. Sometimes you're going to need their EIN. Sometimes you're going to need a copy of their 990. Sometimes you're going to need a letter of support signed by the board chair, and they're out of town because they're in Florida for the next 3 weeks, and you got to wait on that. So make sure you're on top of that. Always start writing as soon as you can, and make sure you always go back. If you've already written out your story, make sure you're including all those elements. So you're able to brag about what makes you different. You're able to state your why. You're able to show what makes you special. Okay. And then as you outline the grant, you always want to type out whatever is the grant outline. If it says number 1, A, need, what is the population, and tell us about the population of the service area. Actually type out 1A and respond to that. If it says 1B, is this a medically underserved area, whatever, explain medically underserved area and write that. So you really want to address that. Make sure you have facts, and the facts are what we're always really good at in healthcare. We'll pull out our facts. We're not as good oftentimes at stories. Make sure you do incorporate stories about patients you've been able to help, services you've been able to implement, the difference you've been able to have on your community. And then you guys are usually really great as supporters, but getting letters of support. And I often tell the story at a critical access hospital in Illinois, tell me that he was going to go get a letter from the Lions Club and the Rotary Club because that was really important in his community. And I'll be honest, in my mind, I kind of thought, okay, great. Is that really going to be that much of a difference maker? I'd rather him go get it from the other clinics and the health departments and everything like that. But I supported him and said, okay. When we got grant feedback, they loved that the Lions Club and the Rotary were supportive of what they were trying to do at that critical access hospital. It showed that full community support. So once again, I always learn things from my clients, but that was an important lesson in that, having that local support and seeing that was a big deal. Make sure you do fill in every line as where possible, even if you have to put not applicable. Don't just skip it. They may very well assume that you are skipping it. Make sure you address every question, include the attachments. When you can, meet with the grantor and either listen to the grant calls, which I never personally do, but I do always review the online FAQs because sometimes they do change things. And if you are applying for a federal grant, or often a state grant works this way too, you can sign up and input your email. So if they make changes, you get an alert. And often there has been a lot of times lately where they've pushed a deadline back by a day. They've moved it up by a day. Very seldom do they move it up. Usually it's pushed back by a day or two, but you want that information. We're working on opioid response program, opioid abatement funding in Tennessee, and they pushed the due date back by about 14 days. So good thing we caught that because there was not a portal to sign up, but I saw it on another email listserv. So you always want to know so that way you're able to engage the best that you can. So, okay. Managing the grant. So first you want to respond to your funder if they call, email, or reach out in any way. And you're going to be like, well, duh, Elizabeth, of course, we all know that. You have no idea how many times your email addresses from the feds, especially, or from a state person, go to your spam or your quarantine folder. So if you do apply for a grant, make sure you are checking that. Additionally, it may be me writing the grant and I'm a low level within the organization, but the person's name goes to the CEO, and you have no idea how many times the CEO will say, oh, I didn't even know about this. This has happened many times. So you don't want that to happen either. You want to make sure whoever's name you're put on it knows, is checking their spam and quarantine folder, or their assistant is, or whomever, and that you are responding to your funder. Make sure the right individuals in your organization understand the grant terms. Last week, when I was speaking to Colorado Critical Access Hospitals, I had a lot of head nods and laughter in the room because there were a lot of CFOs there. And I said, you have no idea how many times I've submitted grants and the CFO has never ever seen the budget. And apparently that's happened a lot because I got a lot of, yes. So please make sure the CFO or the controller or whomever at your organization is appropriate has seen that budget. Make sure you know how you're going to distribute funds and then give credit to your funder. I recently saw a statistic where 95% of grants awarded, people never get a thank you note. So 95% of foundations have never received a thank you note. So again, a thank you note. Now don't overdo it. I had somebody want to hand deliver their USDA rural development grant during the Rural Emergency Healthcare Grant and took 3 dozen fancy donuts to a federal agency. That is considered gifting. They could not take them. The hospital was mad. I told them they couldn't take them. So you have to be careful on that too. You know, you have to follow the rules. But I don't know anyone that can't accept a little thank you note or a thank you. At minimum, an email, but a handwritten note goes a really, really long way with people. I got one last week. I'm still reeling from it from one of my clients. So again, make sure they do that. Do they want recognition or press? Make sure you do that, because people do get their feelings hurt and do not follow through on that stuff. And sometimes, you know, maybe you have to name a room after them for a big donation or something. That's great, but make sure you do follow through on that. Because I do hear funders say, I was told this was going to happen and this never happened. And then what do you do next? Well, to me, grants are a yellow brick road. They tell you just exactly how to go. You write this, this, this. We are entering grant season. I'm going to tell you some ways to get engaged with that. So the first thing you do is you start at the beginning, you follow the instructions of any grant, or you follow the yellow brick road. And you always keep in mind your why and get focused on that. So again, I've already talked about my daughters, but when I focus on them, my work is never in vain. So as I was researching, doing a board charter and reviewing another set of bylaws and an agreement between a hospital and an FQHC that really wasn't fun. When I can focus on these two and then I'm bringing healthcare to people like them, that always makes it fun and keeps me engaged. And so now this is what I call kind of the money slide. So I hope you take something from this. And then if you have questions, you can put them in the chat. Hannah will be providing those, or we can unmute here in a second. But we are entering a big grant season. It is an election year, as we know. I'm not bringing up politics, but I am telling you, typically money comes out more on the even years due to election years and congressional election years. So be ready. If you have not been on grants.gov to look at forecasted federal grants for hospitals and clinics, please do, or go to SAMHSA.gov, HRSA.gov. There are a lot that are forecasted. The October 1st is the beginning of the federal year, so we're just starting to enter it as the money comes out. I know there's crazy things happening with Congress and crazy things happening in our world, but take a few minutes, go look at those. Grants.gov has great search terms. And again, you can look at what is forecasted and what would be relevant to you. If you have not received employee retention credits for your hospital or your clinics, consider those. Please email me if you want connected with those. That is additional. It's not really a grant. It is actually an IRS tax credit, but we've been able to get many critical access hospitals 7 figures. And I said that right, 7 figures in employee retention credits. So that's really important if you have not considered that. In looking at what does everyone use, and we all know what everybody uses to find healthcare, right, wrong, or indifferent, right? It's our phones. And we learned during COVID, who has phones? We say even underserved, what is it? Over 95% of Americans have a phone, right? Even our poor patients that are on Medicaid have phones. So again, we're glad to connect you to the Google Ad Grant or your hospital foundation. If you look on Google Ad Grant, you're going to say a big hospital can't engage. You can't, but your hospital foundation can. And this can be a way to really help your hospital come up on the top Google terms, remove bad reviews, or again, to help do website redevelopment. Make sure you're getting the most of your 340B pharmacy program through referrals. And I will tell you, many hospitals are not capturing that. Also, make sure hospitals or at least rural health clinics are filing your Medicare WRAP payments, Medicare Advantage WRAP, WRAP, to get funding as well. And then where do we find funding? We go to grants.gov a lot. We have people that are on grants.gov, HRSA.gov, SAMHSA.gov, all the USDA Rural Development, all those, and we sign up for all their emails. We also do as far as for foundation grants, and I have used about 5 different grant search or paid for subscriptions to be able to search for grants. And I've never really liked any of them, but I really do like this one, which is Instrumental. And it's not a typo. That's how it's spelled. It's Instrumental without the A. And you can go there to get a free code, a free trial, and get money off your first month. And you also can get, it's 14 days free for each person at your organization. So if you have 3 or 4 of you that work at the foundation and write grants, each of you take 2 weeks. You put in your exact location, the services you provide, what you need, and it has everything at your fingertips. All kinds of foundations that match with you. You can look right then at the foundation's 990, at the board of the directors, and everything like that. And then, so I encourage you to try that. That is the only one that my company uses, and we have actually found that, and I worked in that I work me will make, and I'm sure you can, but if using health information, they a lot of information on rural, a lot of ways to search there as well. And they do a lot of the state and federal programs, whereas Instrumental is mostly private foundations. And then I also encourage you to talk to your stakeholders, talk to your board members. I always give the example in Indiana, everyone thinks of the Lilly Foundation and Eli Lilly Pharmaceutical Company. If you just search and as a grant writer and look for it, you can apply for about this many. If you know someone that works at Eli Lilly Laboratories or Elanco, you can apply for this many. So as you can engage your board members and find out, or your stakeholders in your community and find out about grants, that's huge. And then this is my new example that, again, I stole from Colorado. And that is, we had a hospital CEO stand up and he said he had to get a grant so he could put a nurse practitioner at the schools. The school had to get a grant to put a nurse in his emergency room. And I don't know the exact details, but that goes back to the partnerships. He said he could not apply for to put the nurse practitioner at the schools. The school did. The school had to apply to put the navigator for the students in the ER. So it's pretty cool to think through those partnerships that you can apply for extra money. And then additionally, opioid abatement is coming out. Watch for it in your state. Every state is getting some opioid funding, and a lot of them are going through the regional and county level. So talking to even your local county officials, or I'm sure Gail will be engaging you more on that. But be ready for that, because again, we know the tobacco settlement was a game changer in healthcare, and we expect the opioid settlement to be a game changer as well. And then the next slide, feel free to reach out to us. I think since you registered, we have your email, so we'll be adding you to our email. We send out things around the 1st and around the 15th of the month that have funding opportunities. If you have questions, you can always reach out. We're glad to help. And I know Gail and Sharon would also be glad to help. So at this point, I will be glad to take any questions that you may have or share your grant experience, anything you want. Thank you for your time.
Sharon, or I mean, Elizabeth, can I just chime in? I think this is good
Please.
time to say we have created a flexible, comes out in 4th weeks of the month. So that is going to be our venue and meetings and things like that. So that rather than sending out ongoing emails all the time. So it comes from the same email address that the RHI newsletter comes out of. So please look for that, and that will be a good resource of things that are upcoming and as we hear about them. So.
Does anyone have any questions or comments?
I was just going to make a suggestion with the
Yeah.
grant that I've written. It's been really important to read the entire NOFO before I get started, because some of the key elements are in the attachments. So if you wait until the last week to do the attachments, you may not have enough time to get the letters and the connections and all the things that you have to. So that was just one thing I would encourage people to do, is to read the whole thing before
Yes.
you get started.
That's excellent advice. And just like you said too, and honestly, you've got to be making the connections before then, right? Because typically you have around 60 days to write a federal grant, and typically you have to have letters of support or partnerships now, especially with the Office of Rural Health Policy. They want partnerships. And so, you can't just go make friends within 60 days while you're writing a grant and while you're also running a hospital, right? So, you've got to have some of those things in place. And so when you see that the United Way now has a new CEO in your area, go meet with them. Always ask to do coffee with people and have those partnerships in place, because you will be able to help each other. And let's see, I thought of something else too with the NOFO. the other thing too about that you brought up about attachments. And if is oftentimes the attachments, somebody you assign, the person who writes it can't be also, and then somebody else does the attachments. We've tried doing grants that way for our clients and we've had success, but it's not great. You have to make sure all those things match, right? And that you're like, well, duh, that comes without saying. But you can't just say, well, the CFO gets the budget. You have no idea how many grants I have reviewed as a grant reviewer, and the budget doesn't match the narrative, doesn't match the work plan, right? That's probably the number one thing that hurts people on grants. And even with our grants, we just got one turned down we were pretty upset about, but it's because the CFO changed the budget in the final minutes without us being able to. We had no time. They went in and logged in and adjusted it, and we didn't have time to change the project narrative, so it didn't match. And guess what the reviewer said? It didn't match. It didn't get funded. So, you know, you have to make sure all those things align, which is why you want to have it make up the deadline 4 days before. And again, you want to share the NOFO, but not too much. So take off that cover that says the deadline and make up your own deadline. Okay, that's a good trick too. Because when people see, oh, it's due this day, it's like, no, it's not due this day. We're going to get it done early so we can check that. And that's another bit of review. If you do have an interest in grants, you know, I know Tom Morris with the Federal Office of Rural Health Policy, and Gail could help connect you on that, is looking for rural grant reviewers at the federal level. And I guarantee, like your Komen Foundation, your local United Way, they always are wanting grant reviewers. And that's a way I did that a lot when I got started. And I still do 1 to 2 federal grant reviews and encourage my team to do that all the time, because you do learn differences and what people are looking for. It is a lot of work. I'm not going to say it's that enjoyable, but it is rewarding to say, okay, these are the things that we can learn from. So, and you see kind of the hot items.
And
Anyone else?
The simple things too, like the header and footer information, are really important when you're submitting all these things.
HRSA likes to hide things in those footers. That's a very good point, Gail. There's even rules in the footers. And also those links that they advise you to click on, you probably should click on them and at least check them. Some of them are not helpful and some of them lead to a bunch of information. So be ready for that. And also, if they request that you use their mapping system or their HPSA system or whatever, use that. But be ready, because that's also something you want to do in advance, because a lot of times the government systems will, like, too many people are on them and they clog. So we know in the big heat of federal grant season, most of my team, we work Friday nights, Saturdays, and Sundays on grants, because a lot of those like federal mapping system or the grants.gov work a lot better than when not everybody's on them. Or, you know, you guys work later in the day. I always say our Eastern people take advantage of right when it opens, because a lot of the Wyoming people may not be awake yet. So however that works, you guys do it toward the end of the day. But if you do it like in the middle of the day, noon to 1 to 2, when everybody else is on Monday through Friday, it's really difficult sometimes for those systems to work. They're really slow. So consider that. And again, please go look at forecasted grants. And also, if you're going on instrumental and going to do some research for taking your free 2 weeks, also look at things that maybe aren't open right now. That way you can be ready when they do open. Most foundations are funding very similar projects around the same time of each year. Some of them have 2 or 3 or 4 openings each year. So be ready for that. So don't wait till it's announced and then scramble. Watch and say, okay, we know the Patrick Mahomes Foundation funds things for minority children's healthcare in Kansas City, Missouri, and we're in Kansas City, Missouri. So we're going to, but it's not due till next March. We're going to look at what they funded this past year, so we're ready to apply for that. And also, this is a kind of a specific hospital tip or something that we've learned, and we have had luck with this even this year, and I definitely had luck as a CEO myself. And that is, look at where you're spending your money. So talk to your controller or your CFO. Where's your accounts payable going out? And asking them for if they have a grant program. Many of like the Cardinal Health, the companies that produce medical equipment, they have grant opportunities, or your managed care organizations have grant opportunities that they never publicize, but they do kind of have a secret grant budget. So always consider that, especially for smaller requests. we were able to get like $25,000 to help start a school-based clinic, a grant that was never even announced or would not have been public. So look at where you're spending your money and always ask and reach out to them. What's the worst thing they're going to say? No, but at least they know what you're doing and what you're thinking, and they might be bought into your mission. And maybe, just maybe, they say yes.
Another thing too, kind of going off that, if you have a board of directors, see what organizations they are involved in. That's another tip we've been sharing for finding foundation grants that might not be announced yet.
All right. Well, thank you so much, Gail, for hosting, and we appreciate your attendance. We'll stay around for another couple minutes. If anybody has any questions or comments, we would love to assist. Otherwise, I hope you have a beautiful October day.
Thank you.
And if you happen to write a grant and get it, please tell me. I'm still reeling from like a year ago when someone attended a grant workshop and they later wrote me and said, like, I got a $50,000 grant. I was so excited. So please tell me, because I get so excited about these things. So, all right. Thank you all. Oh, good.
Thank you. Oh, I was just going to ask, could you give me some more information on the EZ ERC employee retention credits? What are those?
So Hannah can put the link. We're doing a webinar about them. And we also can get your email and do an individual email. What it is it's a post-COVID program. It's up to $26,000 per FTE employee. And I say FTE, right? Because that's different than, per employee.
Mm-hmm.
And it's for people that stayed from 2019 that you still retained today. And it is not just for healthcare, but we have learned every healthcare organization qualifies. It's for businesses size 2 that are not members of family up until 1,000 FTEs. There are 2 ways to test. One, and again, our webinar is going to be much better about this. I'm giving you the quick version. One is, did your organization lose money due to COVID? And you can prove it that way. The other, which is where all the hospitals, all of our RHCs and FQHCs have qualified, which is, did you have to substantially change the way you do business? So most CPAs just know of the first test. So if you ask a CPA, they may say, oh, you don't qualify. You got those provider relief funds. No, this is different. But we'll do a follow-up email and connect you as well, just so you can learn. And it's worth hopping on with these people. It is, it will not come into funding until 2024. But again, we have a lot of happy hospitals and rural health clinics. And again, we had a rural health clinic get $78,000 and they were jumping up and down and so happy. And that was like one of our best days. So, it was a game changer for them this year. And the nice thing is these are a tax credit. So there's no rules on how you spend the money. So it's quote unquote free money. I mean, as free as you're going to get,
Right. So. Okay, great. That's awesome. Thank you so much. I really appreciate the resources in this. This has been great.
Thank you. Anyone else? Appreciate your time, and everybody have a great day.